So, good evening, ma'am. I'm PJM Mondano. I'm your physical therapist for today. How are you?
Good.
Can you state your name and birthday, ma'am?
Angela Ga, August 5, 1994.
Okay, so for today, what we're going to do is we'll be performing a peripheral joint mobilization technique. So this is to treat your condition and or the pain that you're feeling right now. So I'll be performing it sa imong wrist area, particularly sa imong right wrist, to improve the joint play of that joint. So this means that we'll be increasing your range of motion to let you perform the normal activities without any restriction or any pain at all. So this activity will require me to touch you. Would that be okay, ma'am?
Yes.
Okay. But before we proceed with the treatment proper, I'll be asking you certain questions to know if you're physically fit to proceed with the intervention. So, have you had any recent events of fracture, ma'am? Were you diagnosed with hypermobility?
No.
Joint inflammation?
No.
Okay, how about, do you have any swellings in your body right now?
No.
Okay. So, but before, again, I'll be taking your vital signs, and I'll be taking your vital signs. So this consists of your blood pressure, your pulse rate, your respiratory rate, and your temperature. But before I do that, let's sanitize first. Okay. So at this point, sir, assuming after sanitation is ni take ko sa vital signs ni patient, and now I'll be proceeding to the treatment proper. Okay, ma'am. So before we'll be doing the katong exercise proper na jud is let's do a quick slow and easy exercise first to warm up your tissues or kanang joint area to let us kaning easily manipulate ang kanang nga joint later. Okay? So again, sir, assuming nga nag-warm up na me and I will be doing the exercise proper. So, okay, ma'am, can you please put your arms sa table? So, wrist top of the table. And then, I'll be using a cloth na ibutang sa imong under sa imong wrist para easier na to move your wrist within the range of motion. So now, sir, kato position of the patient will be in sitting position. Arm will be on top of the table, ang wrist off of the table, and then my arm will be here sa iyahang kaning distal part sa radius, and then my other hand would be holding sa iyahang wrist. So ang motion na ko ani sir sa akong hand will be kaning I'll be moving the wrist in flexion and extension starting from from the available range of motion, so from hinay until ako siyang i-stretch beyond the available range of motion. So for the radiocarpal joint, sir, the capsular pattern would be its full movement would be from flexion to extension. Open back position is in neutral position with slight lunar deviation, and as for the closed back position would be in full extension with radial deviation. So the technique that I chose, sir, would be the non-thrust sustained joint play technique, particularly ang iyahang grade 3, as I'll be stretching increasing the range of motion of the patient. So this is how I will be manipulating the kaning sponge, sir, to show the amplitude or kaning unsa ang pagkuhan ang grade 3. So starting from slow until na ni-reach ka sa task. So that will be how okay, so this is how I will be performing the grade 3, sir. So kaning grade 3, sir, will be, if ako ning gikon sa patient is ako siyang i-maintain ang stretch for a good 6 seconds, and then to be followed with a partial release, and then followed again with a slow kaning movement, and by repeat sir sa movement bata na start sa slow until ni fast. And as for the grade 3, sir, nga sustained is if si patient wala naka-feel o pain or any koan, and if I see nga fit si patient for kaning modification, so ako siyang i-progress into grade 4 as I'll be stretching or man gihapon the wrist. So now, sir, I'll now let the patient go, sir. More to akong demonstration. So, okay, ma'am. So, as you can see, earlier, ako arang i-move imuhang wrist area. So, that would be all. That would be it for our session for today. But before you go, I'll be taking your vital signs again to know if you're physically fit ra ba or overall nimo nga condition kay okay ra for you to leave the clinic or the center. So, assuming nga ni-take kogan sa vital signs sa patients here, so ako na siyang palapon and good to go na siya. So, okay, ma'am. Thank you for your cooperation and thank you for coming. That would be it for our session for today. See you in the next session. So, paglakaw sa akong patient, sir, is nag-aftercare ko. So, nalimpyo ko sa akong area and then, yes, nag-sanitize ko again. So, it's safer. That would be all, sir. Thank you.